I'm Varen Black. Thanks for joining us, and welcome to our webcast. Breast cancer is a disease that can strike any woman, but studies have shown that certain lifestyle factors and personal traits, including your genetic makeup, affect your risk. Joining me today to talk about how doctors determine breast cancer risk is Dr. Seema Khan, who is an associate professor of surgery at Northwestern University Medical School. Let's start with the basic risk factor, age, for instance.
Age is in fact the most important risk factor for breast cancer, and that applies across the world. As women age, the risk of breast cancer increases. It increases most sharply in the reproductive years from the age of approximately 30 onwards. The rate of increase slows down around the menopause, but the increase in risk continues beyond the menopause. And in fact, about 2/3 of women who are diagnosed with breast cancer are over the age of 50. Other risk factors really revolve around lifetime exposure to estrogen and possibly progesterone, which is the other hormone that comes from our ovaries. Estrogen exposure begins at menarche, at puberty, and continues through each ovulatory cycle, each menstrual cycle, until the time of menopause. So one can sort of estimate that duration of estrogen exposure by looking at the age at puberty and the age at menopause. Women who have early puberty and late menopause will have increased risk for breast cancer on that basis.
What other factors? We mentioned genetic factors here.
Well, another aspect of estrogen exposure is also the age at first pregnancy. Women who have their first child early will be protected somewhat against breast cancer.
And why is that?
Some of it is related to the interval between the onset of puberty and the time of the first pregnancy. During the first pregnancy, the breast cells undergo what we call terminal differentiation, which means they prepare to make milk. And in that process of differentiation, they lose some of the ability to divide and develop genetic defects. There are also hormonal changes that happen with the first pregnancy. There's a hormone called prolactin, which helps the breast make milk. Prolactin levels, which may promote the causation of breast cancer, are permanently depressed after the first pregnancy.
What about lifestyle factors?
In terms of breast cancer risk, women who are overweight after the menopause are at increased risk for developing breast cancer. Before the menopause, weight per se doesn't seem to make much of a difference, but regular physical exercise does. And women who exercise regularly 4 times a week or more will have a lower risk of breast cancer before the menopause. Another aspect is alcohol intake. Women who drink regularly 5 to 6 times a week or greater have a significantly increased risk of developing breast cancer. And so it would be wise to restrict alcohol intake.
What options are available for women who are at increased risk for breast cancer, and what can they do to decrease the risk?
The women who are at increased risk for breast cancer can follow some of the advice that's given for general health maintenance. I mean, eat a varied diet, plenty of fruits and vegetables, avoid regular heavy alcohol intake, maintain a close to ideal body weight, exercise regularly. Women who are at particularly increased risk, and in terms of the information we get from the Gale model, high risk is considered to be a risk of 1.7% over a 5-year period. So to translate that into real numbers, if we follow 1,000 women over a 5-year period, if 17 of them develop breast cancer, that's considered to be a high-risk group. And for women who have that level of risk, there are a couple of interventions that are proven to be effective. One of them is use of the medication tamoxifen, which is an anti-estrogen for the breast. It opposes the effect of estrogen on the breast cells, and has been shown in the breast cancer prevention trial that was sponsored by the National Cancer Institute and was completed a few years ago, that tamoxifen use over 5 years will reduce the breast cancer risk of a high-risk woman by 1/2.
Doctor, let's talk a little bit more about genetics, family history, when it comes to breast cancer.
We've known for a long time now that when there are family members affected with breast cancer, that would increase an individual's risk of developing breast cancer. There appear to be clusters of breast cancer that appear in certain families. Those clusters were investigated over many years and resulted in the identification of two specific breast cancer susceptibility genes called BRCA1 and BRCA2. Those genes explain about half of what we call the inherited susceptibility kind of breast cancer, where naturally one doesn't inherit the disease. What is inherited is the susceptibility to develop the disease. And when these two genes are altered in certain families, they result in a greatly increased risk of breast cancer. For the BRCA1 carrying families, the risk of breast cancer in the individuals who carry the altered gene may be as high as 70 or 80%. And in the BRCA2 families, it may be as high as 40 or 50%. In the BRCA1 families, in addition to the breast cancer risk, there's also a markedly increased risk for developing ovarian cancer, which is, of course, a much more lethal disease than breast cancer. Women who have several affected family members should consider and should look into the possibility of genetic counseling to understand more about transmitted susceptibilities. And also there is genetic testing available which will allow an individual person to find out whether she carries an altered BRCA1 or BRCA2 gene.
When should a woman get screened for breast cancer? At what age?
The recommendation for adult healthy women over the age of 40 is an annual screening mammogram. And women who have screening mammograms and have their cancer detected through mammography have a 1/3 reduction in the risk of dying from breast cancer. So that is a very dramatic effect, and is the single thing that a woman can do to reduce her risk of death from breast cancer.
Along with the self-exams.
Along with self-exam is helpful, but in parallel with the mammogram, also a professional breast exam is very important.
Thank you so much, Dr. Khan. We appreciate you being with us. Thanks for sharing with us this information about risk factors and also ways to lower our risk for getting breast cancer. Thank you for joining us. I'm Veron Black.